Hi, Richard Lieberman here at Ageless MD Solutions. Today we're going to take a look at the Frown line with a special look at the strong Corrugator. Alright, so Edward here has a very strong Corrugator, and Edward, I want you to frown, make a very deep frown. And you can see Corrugators are like pumpkins. There's no two that are alike. And the Corrugator is a kind of a primitive communication tool, a pre-verbal tool. So Edward's a very strong male, and he's got strong communication skills through his frown. He can exhibit anger, dissatisfaction. Now I've cleaned him off with Puricin, and I'm going to mark out the Corrugator right now. The Corrugator's full name is the Corrugator supercilii, or the wrinkler of the eyebrow. It originates from the medial end of the superciliary arch of the facial bone and extends diagonally, laterally, and superiorly to its insertion into the eyebrow skin above the middle part of the supraorbital margin. Here, the diagonal lines mark the lateral ends of the Corrugator, and the red dots show the points of administration of the toxin. Notice the little dimples that mark the lateral end of the corrugators. And let's not forget to show the little triangular procerus muscle, which is also an important part of the frowning mechanism. I'll have the patient lift up his frontalis muscle, and I'll draw a line just below the middle, which will mark the superior limit of any Corrugator toxin injections. Now, understanding the anatomy, I'm able to draw the superimposition of the Corrugator muscle on the skin, along with the circle and the cross representing the procerus muscle in the midline. Again, take note of that little dimple marking the end of the Corrugator muscle. In a previous video, I talked about the reconstitution of the products, and I suggested a concentration of 1 cc of saline per 100 units of toxin. I've now changed my practice, and I use 2 cc's of saline per 100 units. This gives the easy-to-use concentration of 1 unit of toxin per 2 hash marks on a U100 insulin syringe. Allergan on-label reconstitution uses 2.5 cc's of saline per 100 units of toxin, making 10 hash marks on the insulin syringe, equal to 4 units of toxin. We'll start injecting with the procerus and administer 5 units of toxin, which is 10 hashtags on the U100 insulin syringe. Each wing of the Corrugator will receive 2 injections. Each is 5 units of toxin. Notice how I use my non-dominant assisting hand to provide good anatomy and a barrier to keep toxin out of the orbit. Same technique for the left Corrugator, and notice the assistance of the non-dominant hand. Five injections, 5 units each. After the Corrugator injections, I also injected the frontalis and the periorbital rhytids. There are videos up of both those techniques, and this is what the patient looks like at the time of injection and 3 weeks later, just enough time to grow a light goatee. The patient is attempting to frown in both photos.